Looking back at Sunday's Super Bowl, one of the most controversial moments happened during a commercial break when this ad aired.
This system wasn't built to help us. It was built to keep us sick and stuck. But not anymore.
The ad from the telehealth company Hims and Hers promoted their compounded weight loss drugs, similar to medications like Wegovy and Ozempic. The ad portrayed the obesity epidemic as a rigged game due to a greedy healthcare system, and it offered a cheaper alternative. Joining me now is Dr. Justin Ryder. He studies childhood obesity and treatment at Northwestern Medicine. Doctor, thanks for being with us.
Thanks for having me.
So I'm curious your reaction to the Hims and Hers commercial. The company has a product that it's marketing here that is not approved by the FDA, but I'm curious, I mean, they spent a lot of money on this ad. So what do you think pushed them to get into this Super Bowl advertising market?
I think it speaks to the desperation in the space and perhaps capitalism in general. There's a lot of obesity medications that are FDA approved, but some of them are in shortage. And some of them there's difficulty in getting insurance approval from both commercial payers as well as state and federal insurances like Medicaid and Medicare. Mm-hmm. And so getting in this space because they see an opportunity, but that opportunity does have risks.
Sure. I want to ask about those risks specifically for these compounded drugs.
Yeah, so the FDA has released a statement saying that these medications are not FDA approved. They do not conform to the same rigors of testing that semaglutide or Wegovy and Ozempic conform to for the manufacturers of those medications, which would be Novo Nordisk. And so you don't really know what you're getting. You could be getting the exact same compound, or you could get something that has impurities in it and may not be as safe. And so my recommendation would be for people to try to stay away from compounded medications if at all possible.
Okay, and usually is it because of the shortage, doctor, that people either are being prescribed the compounded drugs or turning to them?
So nobody's being prescribed the compounded medications. I think that's an important distinction.
Okay.
I think one of the biggest challenges is if you were to go to your physician in the community, you may not get coverage for that medication under your insurance plan. And so the compounded GLP-1s that Hims and Hers and other companies are offering aren't subject to insurance coverage. They're actually not taking insurance. This is being covered out of pocket.
Doctor, with this big ad playing in the Super Bowl and our continued conversation about these weight loss drugs, I'm wondering if you can look into your crystal ball and tell me what you think the future looks like for these kinds of medications.
Well, the future really is we need these medications. And right now what you're seeing is these companies are finding a real opportunity. There's a lot of desperation out there. Poor coverage, poor access to care is one of the biggest barriers that we have in obesity medicine. So what we really need is better insurance coverage. And once we have that, I think these companies are no longer going to be able to sell compounded medications.
Interesting. We will see how this continues to play out. Dr. Justin Ryder, thank you for your time.